You know, when you step back and you look at our hospitals here in the area, how lucky are we to have hospitals like Hopkins in our own backyard? And you know what? Hopkins was prepared for this coronavirus because if we take you back when they were fighting Ebola, they put up this biocontainment, and now they've seen 500 patients leave their hospital free of the virus. And here is the 500th patient now. I want to take you to the Hopkins Hospital, who goes home today after a few weeks, and a proud moment for the staff at Hopkins. WMAR 2 News' Aaron McPherson got to talk with one of the first patients admitted who almost died, but refused to let the virus win.
Ahmad Ayad is always active.
Pretty much, always pushing myself to limits.
So when he was feeling sick in mid-March, he thought he just overworked his body. Turns out it was the coronavirus.
You're thinking it's just, it's an overhyped flu, and I'm not going to get it. What are the chances of me getting it? Being as active as I was, I wouldn't think I'd get something like that. I mean, I normally don't get sick.
Ayad went to a D.C. hospital after 3 days of feeling weak, thinking he was just going to get some medicine and head home.
Next thing you know, they put me in a coma, and they put me on a ventilator, and I wake up the next day. I'm in Baltimore at Hopkins.
He was the third COVID patient at Johns Hopkins Hospital, the first who needed a ventilator.
He is a very athletic, fit individual, and he's young. And so my first thought was, wow, if this can happen to him and he can be this sick, this can happen to anyone.
Dr. Natalie West talked with him briefly before he had to be sedated again, put in a coma for days, like most of the other critical COVID patients.
What we have found in COVID, and it's still unclear to us, is that they are requiring so much more sedation, which is pain medicine, anti-anxiety type medications, way more than what we're used to, 2 to 3 times as much. And we don't quite understand that. So I think it's contributing to how long they have to be on the ventilator because we can't keep them comfortable enough.
Since there are no visitors, family members are updated daily.
I think that was probably the toughest thing when I learned what my family went through, getting calls, saying that your son might not make it through the night.
After 25 days in a coma, Ayad woke up a different person, 60 pounds lighter.
I was basically paralyzed. I couldn't move. All my muscles were gone.
The next step, therapy. Lots of therapy.
Speech therapy because I couldn't talk. And then I had a social worker that came. Social therapy, which, she had to teach me how to swallow. And then physical therapy just to wake up my body.
He pushed himself and his therapists every day.
Let's walk again. And I was like, can I try to walk without the walker? Okay, then you hold your hand. Okay, then I kept pushing them like, no, I want to do more. Are you tired? No, I'm not tired. Even though I was out of breath and my heart rate was up, let's do it again. And I was just determined.
And it paid off. Once he made progress and tested negative for the coronavirus, he was able to go home and do therapy on his own. His walking turned to running and running into lifting. Now 50 pounds up since he was released 2 months ago. Doctors said it would take 8 months to make a full recovery. He has other plans.
September, I should be back to normal. This is my 3 months.
He has a checkup next month to see how his heart and lungs are doing and to see if he still has a blood clot in his arm. In the meantime, he's just going to keep working.
I'm going to be proud of myself knowing that I recovered and I'm back to normal. So I guess that's my ultimate goal is to get my body back to where it was, where I feel comfortable knowing that it's finally over.
There we go.
While Ayad works to get back to his old self, Dr. West is worried about another spike in cases. She's asking everyone to not let their guard down, to keep practicing social distancing, wash your hands, and continue to wear your mask. In Baltimore, Aaron McPherson, WMAR 2 News.